Hello and welcome back. Today we're going to be talking about environmental health, which is a topic that I really enjoy a lot. I think that it's really fascinating to think a little bit about how the environment influences us and our health, and also how we actually change the environment around us. It's also very important. We know that environmental health factors actually cause about 100,000 deaths in the United States per year, which is quite significant. And it sometimes does this through direct health impacts, and sometimes it does it through, for example, changing rates of cardiovascular disease or non-communicable disease health impacts, or perhaps changing the rates that we're exposed to different contagious diseases. So the environment is quite important when we think about overall health impacts for our society. Now, environmental health, when we think about it, is actually broken out into three different categories, which have their own components to them and own ways of thinking about them, but they are all related in multiple ways. Now, one is the unaltered environment, the natural environment. That's generally the environment that's around us that we don't have control over. Then we have the altered environment. So that's typically referring to things that we do to the environment that change health-related factors. And then we also have the built environment. So that's thinking about how the structures we built actually create contexts in which our health is experienced. So let's talk first about the unaltered or natural environment. So here we're really thinking about the things that happen just through natural processes. So these are things like tornadoes and earthquakes and floods, things that have been challenges for humanity for a really long time. There's things, those are more dramatic things, but there's also things like sunlight, which we often don't pay attention to, but it's a major cause for things like skin cancer. Then there's radon. Radon is the breakdown of uranium, which produces a radioactive gas which seeps up into houses, and we breathe it in, and it actually dramatically increases risk for lung cancer and some other cancers. And then the natural environment also can affect how we're exposed to infectious diseases, because the climate and other things like that will determine what types of diseases can be in an environment. So there's a range of different things, elements in which our natural environment, our surroundings, can impact us. And sometimes that's very dramatic and serious in these disaster type situations like the one pictured from an earthquake. And sometimes it's something that's a more gradual impact over time, like sun or radon. Now, the altered environment is thinking about the fact that we as humans actually have a very large impact on the environment around us. And that is due to a range of different things that we do, the chemicals that we produce, the toxins that we produce, the way that we produce pollution in the environment. This, for example, is the Cuyahoga River fire, which was in a river in Cleveland. This was one of the most polluted rivers in the United States in the 50s, 60s, and 70s. It was so polluted, it was just full of all sorts of toxins and oils and trash. And it was so dirty that it kept on catching on fire. The river kept on catching on fire. In fact, the 1969 fire, they said that the fire itself was like 5 stories high. It was a huge fires that would come out. And, this is really appalling when you see the amount of chemicals that we're putting out into the environment, pollution that we're putting out in the environment. And it actually, the result of the 1969 fire was actually that they did start thinking about this on a national level, and actually helped inspire the Clean Water Act. So there are ways in which we recognize that we're doing things, that humanity and the things that we're producing is actually influencing our surroundings, and that can relate to chemicals, and that can relate to radiation, and then also biological agents that we put out that can have health impacts. And so we need to think about what we do and how that is actually having a wide range of different health impacts. Then we also have the built environment. So the built environment is thinking about how human construction and human creations of various sorts influence health. So that would be things like homes. So homes creates, the zones, the zoning rules, the building codes, all those different things have impacts on us. Do homes have ramps? Do they have smoke detectors? Do they have good ventilation? So indoor environments, how the air quality is inside houses is actually really important. People still burn wood-burning fires and wood-burning stoves in their house, and that can actually dramatically influence health in terms of the particulate matter that you're breathing in. So there's a lot of questions around homes and our home environment, but there's also things like transportation, safety of traffic flows, for example, safety of safe walking spaces. These are all things that we would think about. And then businesses and how businesses are structured to protect health can all be related to these health-related concerns, and occupational concerns as well, occupational health concerns in business environments. So, there are a lot of things that we do and we build that create our environments that we also need to think about. So when we think about environmental health, very often we initially go to disasters, and there are many examples of this, and they do have very big health impacts in specific situations, right? So here we're thinking about floods and earthquakes, for example. So we saw very recently Hurricane Irma and Maria had a devastating effect on Puerto Rico. Puerto Rico is currently still recovering. About 400,000 people are still without electricity. The official death toll was around 64, but there's actually been some research that suggests it's actually much higher than that, possibly even into thousands. So there's a lot of recovery that needs to happen, and we were seeing that there's a lot of public health systems that aren't in place in the way they need to be. For example, people aren't having access to medications. And you're seeing a lot of people who don't have shelter, homes to stay in. So there's a lot of concerns with these types of disaster type situations. Another type of environmental disaster can be an interaction between the natural environment and the altered environment. For example, here was the London fog that happened in 1952 in London. Essentially what happened was there was a cold front that came in, which meant that all the coal burning, most people burn coal for heat at that time, all the pollution, particulate matter from that stayed trapped over the city. And it became so dark that people couldn't see, sometimes you couldn't see more than a few meters in front of you. And everybody had to stay inside. And you would have people, for example, that's a picture of a police officer guiding a bus with a torch so that they can see where they're going safely. So it was a really terrible disaster. Now, what they saw is that there's actually major health effects as well. So you see that the smoke increases, and with the smoke comes an increase in sulfur dioxide, which is an irritant for lungs. So the smoke and the sulfur dioxide had a huge impact on health, especially for elderly populations. And what you see there is that there was a sudden spike in deaths. The original aspects were that about 6,000 people died due to this change in pollution, but it actually turns out that it's probably closer to about 12,000 people who died because of this fog that lasted for several days in London. There's another type of disaster, which really are human disasters, like the Bhopal disaster was a release of chemicals that killed well over 4,000 people, around 4,000 people. Chernobyl is a more famous disaster, which the explosion of a nuclear plant, which directly killed around 200 people. But they estimate that the impact on cancer for the area over the following years probably goes up into the thousands. possibly around 4,000 or so that in terms of people who died from cancer related to this. It also has a lasting environmental impact. So even to this day in that area, people don't live there, and there's animals who you see that they have mutations. So there's a substantial impact that is lasting from this. So you can see these disasters coming out both from the natural environment, but also from human engagement. So when we have disasters, something that's really important from a public health perspective is thinking about how we can be prepared. So disaster response is part of the public health system. So there's a few things that we need to do to be really prepared to deal with an environmental disaster. One is having systems in place so you can rapidly share information. If people don't know what's going on, it becomes really hard to handle this situation. Having systems for managing resources can be really important here. So making sure you know what's where, what money you have, what barriers you might have to using those resources. Understanding that is really important to be able to act rapidly in response to a disaster. Ideally, if a disaster happens, you want to issue warnings both before the disaster happens so that people can get away, potentially, but also as a disaster is unfolding, be able to update people on what's going on so that they can perhaps protect their health more during that process. Clear communication also really important. Remember, it can be really scary to be in these situations. And when there's confusing communication, there isn't clear communication, it can cause panic, and that can make the disaster much worse for people. You also have to have systems in place for coordinating search and rescue operations. So many of these disasters, you have to actually go in and find people. If they're buried under rubble, you have to have people who are trained, who are in place to do those types of activities. Then you also have to have education systems, and that's connected to the communication process, but you need to tell people how they can handle these situations. So for example, after a disaster, very often you have things like earthquakes, and sometimes as many people die from infectious disease or lack of food or other things after an earthquake as they do from the earthquake itself. So it can be really important to tell people how to manage that situation. Then there's also has to be a method for triage. So triage is the very difficult situation where sometimes you have limited energy and resources, and you actually have to make decisions about who you're going to give those resources to, and accept that some people, where you can't put in resources and effort, some people are going to die, and you're going to have to put your money and effort and time and resources into the people who are most likely to benefit from that. And that's a very hard situation for emergency responders. Another thing to think about is that you will have people who die or who are harmed in this process, and you want to have a process in place for helping track those people to different hospitals, to different locations. So that is an important element to this, to have that plan. For example, in Nepal, when there was an earthquake several years back, they had a lot of challenges in terms of getting people to access care because they had to bus them out into India. And so having plans for where people are going, making sure that they can get to them and make sure that they're not overloading one hospital while another hospital is sitting empty is a really important thing. You also want to have systems for tracking survivors and patients. So when this disaster happens, often families are separated, so you want to help them to be able to connect with one another after this and know who is alive, because it's obviously tremendously scary. Having backup healthcare resources, so making sure that you bring in additional resources and that you know what is there and available is important as well. And then you have the issue of managing volunteers and donations. So volunteers very often want to show up and help, but there's certain circumstances in disaster response where it's actually a burden, right? So sometimes for these disasters, you'll have a whole bunch of people who show up, and they actually cause harm because they're more of a burden on the system because there aren't many resources to go around, and they essentially get in the way. You also want to manage the donations so that you're getting the right things. So maybe you need food, maybe you need clothes. Making sure that those messages are clear so you get what you need is important. And then the final thing is expecting the unexpected. These are situations where you have a hurricane and then you have an outbreak of a disease, and you don't expect that outbreak, but it happens. So you need to keep on monitoring things and pay attention to things as they evolve, because in these types of situations, situations change very fast. So despite the fact that we often think about disasters in environmental health, a major hitter here is really these gradual exposures that aren't dramatic. And very often we don't pay as much attention to these gradual environmental exposures that are actually much more important in terms, or lead to greater mortality over periods of time. So, there are many different examples of this in terms of gradual exposures, but I'd like to talk a little bit about chemicals that are available, right? So at this point, we have a lot of chemicals in the environment. We have about 83,000 different chemicals in the US markets, most in industry and commerce, but there are a lot of chemicals out there. We also produce new chemicals, about 1,000 new chemicals per year, and we're also producing more. So our production of chemicals went from about 1.5 billion kilograms in 1935 to 150 billion kilograms in 1995. So we're producing more chemicals and more different kinds of chemicals, and we're producing a greater volume of those chemicals that we are exposed to. So when we think about these chemicals, there's a range of different factors that we consider, and these different exposures that we're considering in terms of these gradual exposures. One major factor that we want to think about is how are people exposed to these chemicals, right? And what is the timing of that exposure? When is this happening, right? You'd also want to think about the stage of life. Who's being exposed? So children and the elderly are particularly vulnerable, for example, to these chemical exposures and other types of exposures. You also find that for a range of different exposures, having other diseases will actually increase the impact of that condition. For example, being immune compromised, or if you already have lung conditions, having more pollution actually has a greater impact on you. And then you also have a range of people who have special sensitivities. We know that we have different genetic responses to chemicals and things in our environment. And some people actually respond more strongly to them, and they might need special treatment. So when we think about chemical exposures, we want to consider how you're actually exposed to them. So different chemicals will affect us differently depending on the route that we're affected by them. Now, one could be through air. So we could be exposed to particulate matter through our lungs, for example. Another could be through food. So it could be contaminants in food. It could also be biological contaminants of various sorts. We also have things like soil. So there's a lot of lead in soil from the various building, lead and paint, for example. And then we also have water. So, mercury in the water, for example. All these things can enter into us through our skin and through the GI tract. So understanding the mechanisms by which we're exposed to different types of chemicals in the environment is actually fairly important for understanding the health impact that we can anticipate. So it's very common that we'll actually find for a lot of gradual exposures that there is actually multiple paths to those exposures. So lead, for example, we have lead in the air from gasoline that's still there and maintained, and also we see it for countries which still have leaded gasoline. We have it in the soil. We have it in things like toys. Sometimes we keep on having these issues of paint on toys having lead in the paint and children chewing on it. We have dust in houses, sometimes internal houses. And then we have it in the water sometimes from leaching from plumbing into the water. So there's a lot of different ways in which we are exposed to lead from our environment. So understanding the mechanisms that were exposed, understanding how bad each of them are, and understanding the risks of exposure are really important for understanding these chemical impacts. Now, chemical impacts are really important. We know about a lot of different chemicals that have a tremendously bad impact on health, ranging from impacts on cancers to heart disease to a lot of different health conditions that are quite serious. But there is some hysteria around chemicals. Chemicals, some are bad, some are helpful, some are entirely neutral, as far as we can tell. Just because something is a chemical or has a strange sounding name doesn't necessarily mean it's bad, right? Our question is, how do we determine how bad it is, right? So you can actually have a chemical that you're exposed to, but for certain chemicals, they actually won't pass the skin barrier or won't enter into your GI system. So just being exposed to a chemical doesn't necessarily mean that because of biological systems that you'll actually have any impact from it, right? So in that sense, when we think about the toxicological paradigm as sort of the process by which we go from an exposure to a chemical to an actual clinical disease, we need to think about, if you have an exposure, how much internal dose of that exposure you get. If you're exposed to a chemical in water, does it actually enter your body, or does it just wash off and you don't need to be worried about it? You also think about, if you get you get some internal dose of a chemical, how much of that is actually biologically effective, right? Does that actually mean that you're going to have a biological response to it? Remember, our body has our liver and other organs have a tremendous capacity to deal with chemicals and to neutralize them. So our bodies are actually very resilient. And just having an internal dose of a chemical doesn't necessarily mean that there'll be a negative health impact. Remember, in our body produces formaldehyde. Now, formaldehyde is a carcinogen and causes major health impacts. But, it's normal for us to have formaldehyde traveling through our body, and our body has systems in place for handling it. It's only when that formaldehyde gets above a certain level that we really have to be concerned, right? So once you have a dose that might have a biological impact, then you actually start seeing some early biological effects. Now, that may or may not progress, but ultimately may produce altered structure and function of your organs, and ultimately lead to a clinical disease. Now, this progression is quite important, and understanding this progression and how it works is very important to understand each different chemical and each different process that we're dealing with. It's also important to know that the steps in between this progression are actually moderated by other factors, things like genetic factors. I mentioned the liver and liver enzymes. Well, liver enzymes are really great at dealing with toxins, but we have genetic differences in how good we are at dealing with different toxins. We know, for example, that people respond very differently to alcohol. And that's because we have genetic factors that determine how the body responds to these things. And that's true for most chemical responses. But there's other things like what you're eating and your overall health and your personal habits and medications that you're taking and co-exposures. Sometimes having multiple different exposures can make a difference as well. So that's important to understand these health effects. All right. Now, in addition to these, to having multiple routes of exposure, we also want to think about the fact that multiple exposures can have a huge impact. So I spoke earlier about radon. So what's interesting is that, like for non-communicable diseases, in environmental effects, we actually see that there are sometimes multiplicative effects in addition to additive effects. So, for example, smoking increases risk to about tenfold risk, and radon over 10 parts per million increases about 4.5 times the risk. Now, you could think you could just add them together if people are exposed to both radon and smoke. But it actually turns out that you have about 40 times the risk of developing lung cancer in those situations, right? So that's a very serious condition. And we know that about 15% of houses actually have radon levels in their basement over 10 parts per million. So it's a real consideration. And these interactive effects are really important for thinking about environmental health, because for the most part, we don't know a whole lot about them. They're actually really kind of hard to study and complicated. And when we have, as I said, over 83,000 different chemicals circulating in the environment, understanding the ways that they interact to influence health, one chemical might be fine in one circumstance, another chemical might be fine in another circumstance, but you combine those two and they might have a health impact. Well, that's a serious concern. And we don't really know exactly how that's affecting us. We know that there are certain cancers and other things that seem to be increasing, and it's possible that's due to chemical exposures. So it's an important question and concept to think about as we think about what we're doing in terms of environmental and occupational exposures. So speaking of occupational exposures, very often the way that we learn about health impacts of environmental risks and chemical risks is actually due to exposures in occupational settings. So there's this whole field of public health which is focused on occupational health and safety. And that's really focused on how we ensure that that people who are in work environments where they're exposed to different chemicals and various different types of risks, perhaps mechanical risks, for example, are protected. And there's various different things that we can do in work environments to decrease those risks. So the reason that occupational health is so important for helping us identify chemical risk factors is that when you're in these occupational settings, sometimes you're exposed to a very heavy level to a certain chemical. So, for example, chimney sweeps were exposed to soot, and we found the association between soot and testicular cancer, right? There's a very example of radium. So this is a picture here of what are called the radium girls. So these are young women who worked in a factory where their job was to paint glow-in-the-dark paint onto watch faces so that you could see the dial, the hands as they were moving through the dial, right? And they used radium to make this glow-in-the-dark paint. And at the time, radium was incredibly popular. People thought that was the best thing ever. They even had like radium-embedded underwear and radium, various radium products that were very expensive and fancy and popular among the rich. Anyway, in this factory, these young women were in charge of painting the dials, and even though they knew at that time that radium probably was dangerous at high concentrations, and the factory manager said just sort of generally, yeah, you should probably not eat a whole lot of this radium paint, but what the women did is that since the hands on the dial are very fine, what they do is they would put the paintbrush in the paint and then paint the hand, and then they would use their lips to lick the end of the brush to make it a fine point. So they would consume a lot of this radium paint as they were painting the hands of the dial. And essentially all the radium, the women who were in this factory died of really serious and very debilitating cancers. It's a really horrible disaster. But it did indicate to us that maybe we should not be using radium and that we should view this as a health risk. It also spurred more awareness around occupational health and safety, and there was lawsuits that came out of that against a company that didn't protect their employees appropriately. So when we think about these chemical and radiation and other types of health-related risks, so there's a few different things that we consider. So when we think about chemical risks, we want to ideally, we want to use our sort of international standard, which is looking at 6 different factors related to health impacts of these chemicals. So one is acute toxicity. So that's where, for example, the dramatic exposures, where if you're exposed to benzene, you suddenly have a strong physical reaction to that. So that's one acute response to a chemical. But there's also chronic toxicity. That's when you sort of have toxicity from exposure over time. Then we have developmental or reproductive toxicity. You might not feel a health impact, but it might actually influence your ability to have children or have developmental defects for your children. Then you can look at whether or not these chemicals cause mutations. Some of them bind to DNA and cause mutagenicity. And then there's ecotoxicity, effect on the environment. So it can also impact our wildlife, for example, DDT and the role in influencing birds, for example, fracturing eggs, so that there was impact on bird populations. And then there's things like environmental fate. So how is this chemical maintained in the environment over time? So some of these chemicals can just last in the environment over long periods of time. Mercury, for example, a lot of it was released from manufacturing and other sources over periods of time, and it still just persists in our lakes and oceans and streams. So there is a lot of chemicals that just exist in the environment for historical reasons. So as you can see, these are important questions to ask about chemicals. And really, we would want to know about all 6 in order to be able to answer what the effect of a chemical is on health. So despite that fact, one of the real concerns about chemicals, and as I mentioned, over 83,000 chemicals that we're using, is that we don't know a lot about the health impacts of these chemicals, right? So, for example, a review looked at 3,000 high production chemicals. And these are defined as chemicals that are produced over 1 million pounds every year. Okay. So for those chemicals, when they looked at it, only 7% of those chemicals had information on all the 6 SIDS categories that I mentioned in the previous slide. There were actually the remainder of them were missing at least one of those different factors. Some of them were missing many of those different SIDS categories of information. And about 45% of them actually have information on none of those categories. So here's chemicals that are produced in huge volumes, and yet we don't know anything about it. Now, that might concern you. It concerns me. And, there's been some work to push to do that more, and there's been some progress on that. But the truth is it's actually fairly hard to do this type of research to determine all the different health impacts of these different chemicals, right? So looking at whether something is a carcinogen or not is an expensive study. That being said, if you look at the amount that it costs to do these chemical screens for the 6 SIDS categories, it actually only ends up about being $427 million for these high production chemicals, which really doesn't match up a lot to the profits that the companies are making off of them. So an interesting question, an interesting problem, and something that we really need to consider as we move forward in terms of the altered environment. So again, when we think about these environmental threats, it's really important to think about vulnerable populations. So when we think about health disparities, this type of concern that we see also tends to impact vulnerable communities more than privileged communities. So very often, if you look at where pollution-emitting factories are located, they're typically located in poor parts of town, right? So there's a huge area of public health which is really thinking about environmental justice and how we ensure that these environmental risks are not focused on people who have the least opportunity. So we see that lower socioeconomic groups get disproportionately affected by health impacts, both environmentally and in occupational settings. And we also see children and the elderly are often much more vulnerable to environmental impacts. Then we also have marginalized cultures, which may have disadvantages in terms of being able to fight against having factories in their communities, or because of lack of information about the health impacts of things. You also have disabled folks. So if you have a disaster like a hurricane, well, what happens to people who are in the hospital? How do we make sure that the power doesn't go out, right? How do we make sure that people who are relying on medications get the medications they need, right? Making sure that we have those processes in place to protect these vulnerable populations is tremendously important. And then we also have people who are genetically susceptible, who have their own needs in terms of being able to handle, for example, chemical exposures. The important thing to note here more broadly is just the idea that vulnerable groups typically have the least power to change their environment. It's very hard if you're poor to move out of your neighborhood that has a lot of exposure to pollution, for example, right? You have less control in those situations. You have less ability to purchase different things that would decrease your overall risks. So it's something to always keep in mind in these environmental contexts. When we think about environmental contexts, it's also important to consider injuries as well, right? So injuries fall into a category of really thinking about the built environment, but also in terms of what types of situations we create that affect how likely people are to be impacted. So when we think about the built environment, some elements to this are the structures of houses, for example. Are we creating, are stairs safe so that children aren't falling off the sides, right? When we think about built environment, how do we think about safety of people who want to walk? So if you look at this picture, do people have sidewalks that they can walk in? You also might think about the built environment in terms of, how are people going to get somewhere? So if you want to get from point A to point B in this type of structure, it doesn't really make sense to walk because it's so convoluted, and it wouldn't be a pretty environment to walk in anyway, and there may or may not even be sidewalks, right? So these are situations where people are going to be using cars a whole lot more, right? And that has a health impact in terms of car-related risks, and pollution-related risks, but it also has an impact in terms of the fact that people aren't walking in a lot of these neighborhoods, right? So you have a exercise-related impact as well. So these types of built environments can make a huge impact for health. When we think about injuries, though, they are tremendously important. So injuries are actually the leading cause of death for people between the ages of 1 and 44 in the United States. So they're a big hitter in terms of health impacts, and they're in the top 10 for causes of mortality in the United States. So we often think about injuries as being accidents, but the truth is that injuries actually very often have structural or social risk factors that can allow us to prevent them. They aren't just accidents that can't be addressed. There are things that we can do to prevent them from going forward. So seatbelts being an excellent example, but we think about injuries from gun violence. Well, that has social context that we can change in order to effectively decrease people's risk for those conditions, for that health impact. So we can really do a lot to address these injuries. And again, you have intentional injuries, and then you have unintentional injuries. Gun-related violence is tremendously important for health impacts in the United States. And then you also have even more people who have injuries from violence that don't cause death. So it's a big issue. And then we also have unintentional injuries. So unintentional injuries might be things like accidental poisonings or motor vehicle accidents, fire harms. These are some of the top causes that we see for injuries in the United States. Now, one thing to note about injuries is that they disproportionately affect the young. So they're more likely to be in car accidents, for example. Children are more likely to be poisoned. These they also, again, they're a leading cause of death for younger folks. And when you think about overall disability adjusted life years, if you add it up, has a much bigger impact because people are dying earlier on in their lives. We also want to think a little bit about risk assessment. So risk assessment is the processes by which the EPA and other organizations go through thinking about a health-related problem and how they would address it. So here's a process that the EPA put together. And they did this in response to their work related to looking at, I believe, benzene in the work environment and saying that concentrations above a certain level are dangerous. And essentially Congress came back and said, you can't do that unless you show that this is actually a health impact in work environments. So they came up with this process for assessing risks, which have 4 steps. First is identifying the hazard, so figuring out what might actually be causing this health-related problem. The other is looking at the doses, so how much of exposure to a chemical or to some factor actually is needed to have a health impact, right? So looking at how health risks increase as exposure increases. And then you might think a little bit about the way in which the exposure occurs. So how much are you exposed to it, during what processes, in what specific time periods, how many people actually are influenced by this health risk, other factors like that. So how does exposure occur, and what is the processes by which it occurs? Then we have risk characterization. So what is the overall health impact of this? So how much do we expect, how many people do we expect to die from this or have disability and disease as a result? And how do we think about given the different levels of exposure, how much additional risk do we expect at different levels? So that's a risk assessment approach. And if we look at that in the benzene example, for example, we know that when we look at the hazard, we found that benzene causes leukemia. There's a lot of evidence for this from different types of studies. We know that as you're exposed, the risk for that leukemia increases substantially. And that's higher at 10 parts per million versus 1 part per million. And in terms of the exposure assessment, we know that there's actually a lot of industries that have these types of risks, and that they expect overall that about 250,000 workers are exposed to benzene per year. When you take this and you actually crunch the numbers, you find that you would expect about 14 to 17 extra cases of leukemia among workers per 1,000 workers if you're exposed to them to 10 parts per million over a lifetime as opposed to 1 part per million. So we can say, in terms of that risk impact, that it would actually make a difference if we increase the threshold for what's allowed in work environments. So another way to think about this is a public health assessment. And this is where we extend beyond just looking in a specific environment to thinking about public health more broadly. And this really thinks about public health impacts on communities as a whole. So examples of this would be, for example, looking at lead and the lead health impacts from paints and from gasoline and other factors. And because of this, they take a really long time, and they're sometimes controversial. But they can actually lead to substantial policy change around environmental protection. So that's environmental health factors in a nutshell. Again, we're thinking about a wide range of different things here. We're thinking about the unaltered or natural environment. We're thinking where different types of everything from sunlight, gradual exposures like that, to disasters like tornadoes or hurricanes can affect our health. We're also thinking about things like the altered environment, the ways that we have changed things to actually increase our exposures to different things that might cause risks. And then we think about the built environment. How do the things that we've created affect our health? So a lot of really interesting questions to ask, and a lot of potential for change here. So I think it's a really exciting area to think about. So thank you very much for listening, and take care.